The most difficult day of the Premier's time as the Victorian leader. He's been Premier for 6 years and he said today that this decision is the hardest he's had to make. He's declared a state of disaster once again. There was a state of disaster declared during the bushfires. Now he describes this as the public health bushfire. Let's go through the key elements under this state of disaster declared by Daniel Andrews. First of all, the big one, a curfew to come into place in Melbourne tonight from 8 p.m. through to 5 a.m. and that will be in place for 6 weeks. A curfew in our second most populous city. 1 hour of exercise per day allowed, but it has to be within 5 kilometres of the home. 1 visit to the supermarket per household. Only 1 individual can do that per day, again within that 5K limit. Food takeaway and delivery under strict rules and restrictions. There'll be restricted public transport. There'll be no weddings in Melbourne for the next 6 weeks, barring certain exceptions for only in the very rare situation of compassionate reasons. 10 people can leave Melbourne for funerals, and all organised sport, golf, fishing, recreational sport is banned. Let's bring in our political editor, Andrew Clennell. Andrew, really, you and I have discussed the Daniel Andrews approach. He spoke about having the jolt needed for the response initially to COVID back in March. This is a jolt once again from the Premier.
This is the jolt. The curfew is the jolt. And I can tell you that one of the reasons for the curfew is simply the view that young people are spreading this virus. Young people, Kieran, who do not suffer as badly from the virus, although we have had a couple of cases of people in their 20s in ICU. You heard there in that press conference, 53% of people in Victoria with the virus are aged between 15 and 40. So there is a view within that government that imposing this curfew from 8 p.m. till 5 a.m. can make a difference. And that's a view backed in by the federal government, as I understand it. As extraordinary as it is to be hearing of this in place in Australia, like martial law, other countries have used the curfews, and that is the predominant reason why. Daniel Andrews there, Kieran, he said the virus wasn't running wild. And we spoke this morning about in Italy where it was 6,000 cases a day. But he said that eventually, if it went on as it was and the way things are going with just the shutdowns, it would require shutdowns for another 6 months. With 600 cases a day, eventually the public health system would be overwhelmed. And that's where you'd have those dreadful choices we've seen in other countries where people over 80 aren't even treated at hospital and that kind of thing. So let's hear him explain that, why the action is necessary now.
Is it running wild? No, we're not seeing thousands of cases a day. But the best we could hope for if we didn't make these decisions, if we didn't make these changes, if I ignored the advice rather than following it, would be that we might get ourselves into a low number in 4, 5, 6 months' time. That, I think, is just not a feasible option.
Andrew, so to this point, Melbourne and the Mitchell Shire have been in stage 3 restrictions. Let's tell our regional viewers in Victoria, confirmed that from this evening, stage 3 restrictions, actually I should say from Wednesday, 11:59 p.m. The curfew in Melbourne starts tonight. Stage 3 return for regional Victoria this week. Only 4 reasons to be out. That's for care, for work, to exercise or to shop, and restrictions apply to business. The other big one we should mention for our viewers, Andrew, education changes. Remote learning for all of Victorian students from Wednesday. Year 11 and Year 12 students return home. School supervision tightens. So only in the most rare circumstances will people qualify for that. The most essential workers and that sort of thing to have that sort of supervision, and childcare closed as well. So, Andrew, the Victorian government clearly dropped the ball on the quarantine, or the approach was too soft. This is far from soft from Daniel Andrews in the face of this curve, which they say is stable, but at just a far too high a level.
Yes, and I mean, look at that, 671 cases again, 17 deaths. I mean, there's just no sign of this thing You know, it's not progressing out of control exponentially. I think Brett Sutton said they've saved 20,000 cases in total through the shutdowns, but it was 3 or 4 weeks ago Victorians learnt of the shutdowns through the entirety of Melbourne, and they would have been expecting a far different result by now. Instead, they've got to have the resolve now to go for even tighter, more draconian restrictions for the next 6 weeks. I really do feel for the people of Melbourne. Brett Sutton there, the Victorian Chief Health Officer, likening it to shock and awe, a phrase that George W. Bush used at the time of the Iraq War.
In part, there's some shock and awe here for people to genuinely understand that it's a super challenging phase that we're in. We knew that it would be harder. We knew that it wasn't like the first wave.
And Kieran, you mentioned that language around the jolt. Last time in March, Daniel Andrews helped force with Gladys Berejiklian and Scott Morrison's hand in terms of the restrictions. He later likened it on the Four Corners program to a jolt. We've certainly had a jolt with the curfew today, but it has been some time coming. You and I first flagged it 2 weeks ago. Let's listen to him talk about the jolt.
I made a judgment, and Gladys made a judgment as well, that this thing needed a big jolt. We needed to take a big step. I was never going to have a situation, David, where in 6 months' time I look back and said, I wish we'd done more and we'd done it faster. This is life and death, and I think the jolt and the big step that we took that day and since has absolutely saved lives.